No personal or family history of breast cancer.
As a breast radiologist, Dr. Kelly Schenk is somewhat of a Nancy Drew. But instead of mysteries, this sleuth is looking for clues of cancer.
So there was a patient, about 87. She had stopped screening when she was in her late 70s, thinking that she had nothing to worry about. And she had waited until she could feel the cancer. And then, of course, the mass was quite large. She was regretful that she had not continued screening.
It's not uncommon in the world of mammography. Women go for annual exams for a few decades and think they're past the risk.
I've had patients in their 80s with breast cancer, so you're not out of the woods.
When patients ask Robin Dockery when to stop getting mammograms, she asks them a question.
If a woman asks me and they're really in their late 80s, 90s, and they say, do I really need to come? So my answer is always to them, if I found breast cancer today, would you do something about it?
Breathe.
And as long as you would want to treat a breast cancer, you should continue being screened.
Come on in here.
Not just screened, but screened in 3D. Though you may have had 2D exams for years, Dr. Schenk says you should insist on 3D for your next mammogram.
Just hold still.
If it were me, I would want 3D. We just see better, we see more, and you can compare more easily to priors with 3D. 2D, you just get 2 images. And with 3D mammography, we take pictures all the way through in 2 different dimensions. And so we can look through the breast tissue and really decipher what's real.
By real, she means what's a red flag or an area of concern that could be a cancer.
I'm going to bring you up here to the...
The 3D technology is especially good for women with dense breast tissue, which can sometimes mask cancers. And it helps decrease callbacks, meaning you're less likely to need to come back unnecessarily for more tests.
For older individuals, I would definitely say to continue screening, and 3D makes it easier. Decreases callbacks, gets you the answer you want right away so you can go back to living your life and not worrying about breast cancer.